Can you see my screen?
Yes, sir.
Yes, sir.
Yes, sir.
What were discussed in the last class? Can anyone explain? Yes.
Thalidomide tragedy, Cold incidents, the difference among side effects, and we just only stated about side effects, sir.
Okay. All masters and informed students are applying the Paraxel rule.
Yes,
Yes.
sir.
Yes, sir.
Yes, sir.
Everyone. Inform and formed students.
Yes, sir.
Anyone got the test mail or something?
No, sir.
Nothing yet.
Anyone? Neha, Ranguvar. I got the test mail. Speak out. Don't text in the chat.
Yes, sir. I got the mail today.
For tester.
Yes, sir.
Okay. What is your qualification?
So, Doctor of Pharmacy.
Okay. What about others? Anyone got?
Hello, sir.
Yes.
Sir, they're while applying job, sir, they're asking certification, no, sir. For that, we have to leave or just leave or we have to add something, sir.
You can
Yes,
add
sir.
this
I
cleaning
also,
certificate.
I also face this kind of.
You can add cleaning certificate. In educational certificate, you can add your graduation certificate. So then other certifications, you can add cleaning certificate. If you did not get the certificate also, you can add it. No problem. That you are doing the course, no? You can add that.
Sir, but they did not get the cleaning certificate also.
It's okay if you don't get the certificate, but just add the details I'm saying.
Okay, sir. Okay.
NAPTEL certificate. So this is not relevant, I think.
So can 6-year PharmD students apply?
When is going to complete your graduation?
So probably in June, July.
June, July, you can apply, but maybe they need, provisionals and all. But Paraxel can take the ongoing students also. Like if you are in the last 1 or 2 months also, they might take you Paraxel. So we can apply 2026 passed outs. Those who are going to get graduation in the May, June, July, you can apply.
Okay, sir.
Sir,
Yes.
sir, can you tell about the assessment we are going to have if we get the mail, sir?
Did you get the mail?
No, sir, not yet.
Assessment is just like aptitude only. It's individual to individual, different. Mathematical, English, some reasoning, logical. So that is non-technical part. We can't estimate the questions also even. But it's very easy to shortlist.
Okay, sir.
If you just focus in the main time of exam, you can able to easily crack that. But if you qualify the test, then only they will arrange the interview for you. If you are qualified in the test and you're going to attend the interview, definitely will get shortlisted and you will get the job. So, but read the notes. Sorry?
Is that test is easy or tough?
Depends upon you.
Okay, sir. Okay. Thank you.
See, it is just like aptitude. Some people can handle that question, some people cannot. Like this is easy, that is easy only, but just you need some focus at the time. Okay.
sir.
Okay, let's move to the class. So in the last class, we discussed about
Excuse me, sir. Sir,
yes.
sorry, but one question or one problem which I'm facing while applying is, sir, I'm experienced and in the production, but while applying the roles, no, whether we have to write regarding that or not, sir, in that experience section.
It's expensive. Yeah.
Sir, 1 year of experience in production, sir.
What is your passed out year?
Sir, 24 passed out and 24 October I passed out and November I got job, sir. So now 13th
You're
month
MSc
is running.
student.
MSc
You're
Biotechnology.
MSc student, right?
Yes, sir.
Okay. For some jobs which are especially looking 1 year experience, you can use resume application with experience. If they keep for freshers, especially freshers, then remove that.
Okay, sir. But while whenever they're asking 1 year experience, there can I put that the production experience, sir?
Yes. Yes, I am telling yes.
Okay, sir. Okay.
Okay, so let's move to the topic. So we were discussing about side effect, right? Next, adverse event. So very important question. Adverse event definition. What is adverse event? First, common statement. What is common statement?
Any
Any-
unwanted, undesired, untoward medical occurrence after the
any
administration.
undesired, unwanted medical occurrence after the drug administration which necessarily does not have to have a causal relationship with treatment. So very clear definition, does not have to have a causal relationship with treatment. Without this word, I mean this concept, there is no definition for adverse event. Anywhere you are answering the adverse event, this whatever I underlined is very, very crucial part of adverse event definition. So without that, there is no answer for adverse event. If you simply type adverse event in the Google, you will get different answer, but this is guideline specified answer. So any unwanted effect, undesired effect that is after drug administration, but which necessarily does not have to have a causal relationship. What does it mean? For example, you take X drug at 10 a.m. in the morning. So now you got, let's say you took some Pani Puri, example I'm taking, at 11 a.m. in the morning. And you got stomach pain at 12 p.m. Now you are telling this stomach pain caused by drug, like you are suspecting the stomach pain caused by drug. Now this case will be sent to the PV team because you are suspecting this stomach pain caused by drug. So when you send to the pharmacovigilance team, this pharmacovigilance team will do one procedure called as ICSR, right? Individual case safety reporting processing. What is a major what is a major concept of ICSR? Finding the causal relationship. What is causal relationship? the actual relationship between the drug and adverse event. So they will do this procedure in the ICSR. Now, after doing the causality assessment, it is clearly mentioned we did not find any reason that stomach pain caused by adverse event. Okay. After doing the causality assessment, we did not find any relationship that stomach pain caused by this drug. It may caused by drug, it may not caused by drug, but as per the assessments, there is no reason to say the stomach pain caused by drug. It means it may be caused by Panipuri, it may be caused by any other reason, it may be caused by drug also, but it is not clearly identified it caused by drug. So it necessarily does not to have any relationship. It is just like unwanted effect. I got some unwanted effect, but when we studied that in the causality assessment, we never found that this drug caused the stomach pain. So in that case, we can count it as adverse event. So this word is very important, like this statement, which does not have to have. There is no need that the adverse event have relationship with treatment. We did not found the reason anywhere, clear reason we did not find that stomach pain caused by drug only. Then we can count it as adverse event. Clear? Everyone. So if you want to make it clear, a adverse event may or not caused by drug, but it was not clearly identified because of drug in ICSR. Got it? So maybe may not be caused by drug, but we did not find clear reason. It was not clearly found because of drug. Then it's called as adverse event. Clear? I will log the meeting. Some people are joining very late and asking that repeat the concept. So better I log the meeting so then nobody can join, right? After 10 minutes, 20 minutes. If you're not interested, then don't take the course. Better, right? Next. Shall I go to next? Adverse drug reaction. I'm going to the next. Everyone.
Yes, sir. Yes, sir.
Yes, sir.
Yes, sir.
Keep the heading for adverse drug reaction. So very important question again in the interviews. Adverse drug reaction. ADR. Statement. Any unwanted, undesired, untowards medical occurrence after the drug administration and which is necessarily have a causal relationship with treatment. Just opposite to adverse event. It is clearly saying necessarily have a causal relationship with treatment. So it is pakka caused by drug. So the word itself in the definition, drug event, adverse drug reaction. The adverse reaction due to drug only. So when we have done the ICSR processing, it is clearly proven in the causality assessment, this drug only caused this adverse event. Then it's counted as adverse drug reaction. So adverse event is not clear that it's caused by drug, but adverse event, it's very clear that it's caused by drug. Got it? Understood?
Yes, sir.
Yes, sir.
Hello, sir.
Yes.
Sir, both are like any unwanted, undesired, unwanted medical outcomes only. So, or difference between the adverse or drug reaction and ADA, adverse
The
event.
only difference is this. See, any effect you got, stomach pain is there. Stomach pain is unwanted effect, no? Stomach pain is unwanted effect. After the drug administration, you got stomach pain. But this thing, especially when you studied in ICSR, if we did not find this stomach pain is really caused by drug, then it is categorized as adverse event. Okay. Again, another case, another example, let's say, drug caused, when drug taken and then patient got stomach pain, then this case is processed in ICSR in other patient, let's say, other drug or other patient. And when we studied the causal relationship, it's clearly proven that stomach pain is caused by drug. Stomach pain is unwanted only, no? So in that case, it is categorized as adverse drug reaction. When you proven that it's because of drug, it's clearly identified the adverse event caused by drug, then adverse drug reaction. It's not clearly proven it's not caused by drug, it's caused by drug, then adverse event. Only definitions are different. All are adverse event itself, adverse, the word itself clearly unwanted effect only, no? Got it?
Okay, sir.
Next. Keep the heading for serious adverse event. What is serious adverse event?
The
SAE?
results in death, hospitalizations, and disability, sir.
Okay. So don't tell directly death or disability. If somebody died, it's a serious adverse event. Huh? If somebody died in my village, should I call it a serious adverse event? Somebody hospitalized, should I call serious adverse event? Definition should be very clear in the interviews. Death is not serious adverse event. After taking the drug, you got one adverse event. Because of adverse event, you died. That is serious adverse event. This statement is that important. Are you getting?
Yes, sir.
Any unwanted, undecided, untowards medical occurrence after the drug administration and which leads to any of the seriousness criteria. So very, very important. Any of the seriousness criteria. Next point. The seriousness criteria is death, disability, hospitalization, birth defects, medical significance, and life-threatening. So this is the way you have to answer. So any adverse you got, for example, you got stomach pain. After getting the stomach pain, you're getting severe stomach pain, and then you went to doctor, and doctor said you have to hospitalize for 1 day because you have stomach issue because of drug administration. Then he will put you on the bed, you have to hospitalize, then they will give you some treatment, you are hospitalized. Then it's called as stomach pain leads to hospitalization. Then it's called as serious adverse event. Stomach pain leads to death of the subject, serious adverse event. Like that. Got it? Any adverse event which causes seriousness criteria, like death or disability. So these are all counted under serious adverse events. So very clear definition, very, very important definition. Done? Everyone.
Yes, sir.
Yes, sir.
Yes, sir.
Next. Shall I go to next?
Yes, sir.
Keep the heading for SUSAR. Next one, SUSAR. What is SUSAR full form?
Suspectedly unexpected serious adverse reaction.
Suspectedly unexpected serious adverse reaction. So this abbreviation asked many times, like full form. They asked many times the full form of SUSAR. Suspectedly unexpected serious adverse event. So what is the definition? So very important definition, write the statement. Any unwanted, undesired, untowards medical occurrence after the drug administration and its nature, intensity, and severity are not in accordance with product authorized label. So what it is saying, unwanted effect, its nature, intensity, and severity are not in accordance with the product label. For example, you take the paracetamol. Did you write? Everybody written?
Yes, sir.
Everyone written?
Yes,
For example, you took the paracetamol. Then after paracetamol, you took the paracetamol in the night and morning you died. Let's say example. Somebody taken the paracetamol in the night, morning he died. Do you expect paracetamol can cause death? Somebody taken the paracetamol in the night time, morning he died.
Okay.
Do you expect paracetamol can cause death?
No, sir.
No, sir.
Is it anywhere reported on the product label of the paracetamol it can cause death?
No.
No, sir.
For example, recently happened cold rip syrup. On the product label, anywhere on the product label, it mentioned that cold rip syrup can cause death.
No, sir.
No, sir.
Nobody reported that. Unless it happened, nobody knows that cold syrup is going to kill someone. Thalidomide example. These are all SUSAR cases. Thalidomide, unless it becomes into the reality, nobody knows that even the paracetamol, even the thalidomide label also didn't mention anywhere it can cause the teratogenicity and teratotoxic effect. So nobody expected that. Its nature, severity, intensity, completely unexpected. Because in the product label, nowhere mentioned paracetamol can cause death, but it was happened. After paracetamol, only patient died. After paracetamol, only patient died. After thalidomide, only patient got phocomelia. It is suspected because of phocomelia, because of thalidomide, but it is unexpected and it's serious. So in the SUSAR cases, 3 criteria should meet. In SUSAR cases, 3 criteria should meet. What are those 3 criteria? Such as first one, suspected. Second one, unexpected. Third one is serious. The adverse event should be serious. It may be death case or disability case or congenital anomaly case or life-threatening case. Case should be serious case, but it is suspected after the drug administration, but it's clearly unexpected because the product label doesn't mention anything about this SUSAR it is going to happen. So if these 3 criteria met, then only it's counted as SUSAR case. So small difference between the serious adverse event and SUSAR, both are serious only. Serious adverse event also serious only, SUSAR also serious only. But what is the small difference between those? Serious adverse event can be expected, but SUSAR pakka unexpected. Are you getting what I'm talking? Are you getting?
Yes, sir.
Yeah. So this is a major definition for SUSAR. Very, very important definition. Now, shall I go next?
Yes, sir.
Write a note point. Write the note. First point, all the serious adverse event cases must be reported to the regulatory body within 7 to 15 calendar days. All the serious adverse event cases must be reported to the regulatory body within 7 to 15 calendar days. Next. Very important notes, guys. These are called as timelines. These are also called as serious adverse event timelines. They will ask you what is the timeline of serious adverse event. All these SUSAR cases, all the SUSAR cases must be reported to the regulatory body within 7 calendar days. Calendar days means what? Working days means what?
Calendar days include holidays and working days does not include holidays.
Very good. So SUSAR timelines are 7 days, or less than 7 days. SAE timelines are 7 to 15 calendar days. Next, these are both serious cases. All the non-serious adverse event cases. All the non-serious adverse event cases must be reported to the regulatory body based on country-specific timelines. Okay, these are called as periodic reporting. So this is nothing but based on the timeline of country. Usually, if you can see, usually for US FDA, non-serious cases starts from 90 days of marketing. For European Medical Agency, non-serious cases starts from 180 days from the marketing date. From marketing date, sorry, marketing receiving date, better for clarity, right? Receiving date. From adverse event date, receiving date. Marketing date also okay, but better for more clarity from receiving date, since receiving the case. Since case received. Case received. You will get more clarity on these times in the ICSR processing. But as of now, understand, serious adverse event should be reported within 7 days to 15 days. We can count from the since the data has been received. A case has been received. 7 days for SUSAR cases. Non-serious cases will be changed from country to country. Country-specific timelines are followed for non-serious cases. But serious cases, pakka. Without respective of any time, any country, serious adverse events pakka reported within 7 to 15 days, irrespective of country. SUSAR cases should be reported within 7 days, irrespective of country. Got it? Everyone, what does it mean? Why to report the serious adverse event faster? Why to report the non-serious adverse event slowly? Why? Let's understand that. Why to report? Yes.
Sir, serious adverse event may lead to death. Sir. So
See,
Sir, 1 minute.
adverse. Should I stop?
Sir, can you show me the previous page?
I think I'm giving much time. I'm writing, I'm explaining, still you are not writing.
Okay, sir.
Don't take the screenshots. You might miss the sequence. Write the notes immediately. If people are taking the screenshots, then you might not follow the proper writing steps. If you take the screenshots, first write the content I am writing as it is. Okay, next. See, adverse events can be two types. One is serious adverse events. Adverse events can be two types. Some are serious, some are non-serious. Right now? So adverse events are two types. Some are serious, some are non-serious. Now, serious cases are SAE and SUSAR. These two comes under serious adverse events. Non-serious means non-serious, which are not a serious adverse event. Now, these non-serious cases reported faster. These reported faster. These reported faster. Called as expedited reporting. You will get to know this clearly in the in the ICSR. These are called as expedited reporting, fastest reporting. Now, non-serious cases are reported based on the timelines. Non-serious cases are reported on timelines. based on country specific timelines called as periodic reporting. So these are reported periodically. Okay, so forget about this non-serious cases, but serious cases should be reported faster. Faster means within 7 to 15 calendar days. But non-serious cases based on the timelines. Some countries will have every 3 months once. Some countries will have 6 months once. Some countries will have every 1 year once. Some countries will have every 3 years once for non-serious cases. But serious cases common for all countries. Serious case reporting common for all countries. But non-serious cases can vary to country. Now, why to report these serious cases faster? Why to report these serious cases faster? For example, shall I go to next slide?
Sir, what if we don't report the this adverse events within 15 days? What if it exceeds, and then we are 16th or 20th day, if you are going, they will accept, or the regulatory body will not accept? Like a pharmacovigilance team.
So they will accept, but because it's a serious case, we have to report it to other healthcare system. They will accept it, but they might, take some disciplinary actions on you for delay. Got it?
Okay. Okay.
Next. So why to report the serious adverse event within 10 days, 7 days or 15 days, for example. So very important concept. Why you have to really report the serious adverse event cases faster? Why to report serious adverse event cases faster? For example, I'm explaining like example. Let's say one particular drug is marketing in different countries. X drug marketing in different countries. It is marketing in, let's say it is marketing in India. It is marketing in Japan. It is marketing in US. It is marketing in Europe. Let's say X drug marketing in X drug means recent example you can take, let's say Caldrip syrup. Example I am telling Caldrip syrup. So this is marketing in different countries, let's say. But in Indian population, it caused death cases. So this particular drug in Indian population caused death. These death cases, whatever the drug which caused death in Indian population, these death cases taken by MH. Who is MH? Who is marketing that product? Okay. In Indian population, it caused death. In Indian population, it caused death. Now these cases taken by MH officially need to conduct ICSR, because whether this death is really because of my drug or not, I want to know first. Somebody is telling after taking Caldrip syrup only, the child died. Now MH, whatever that MH, Srisan Pharmaceutical Company, need to take that case. Today I take the case. Today starting from day 0. Today I took the case. Tomorrow it will become day 1. Day after tomorrow it will become day 2, day 3, day 4, day 5, day 6, day 7, 7, 8, 9, 10, 15. So today I received the case. Then I am responsible for ICSR processing. Different steps are there. Around 10 steps are there. After completing ICSR processing, the major intention of ICSR processing, causality assessment. In the causality assessment, they proven that this particular drug only caused this adverse event. The death was due to Caldrip syrup only. It's clearly proven, and it's a death case. Death case means serious adverse event. Now, this all assessment they need to make a report. Who has to make a report? MAH, and submit this case to CDSCO first. Submit to report, submit to CDSCO because our Indian regulatory body, because it was happening in India. Now this CDSCO should inform to WHO. CDSCO inform to WHO. What CDSCO is informing to WHO? Dear WHO, one particular drug is marketing in Indian market. It was caused death cases in Indian population. It has proven it's because of drug. And we have completed all assessments. So this MH to report it to CDSCO, this complete process should be completed within 7 days because it's completely SUSAR case, death case unexpected by Colrip. Within 7 days, this MH should report it to CDSCO. Now CDSCO will inform to WHO because World Regulatory Body is WHO. Now WHO should alert Japan, should alert US, should alert Europe. This will be creating awareness. WHO is responsible to create awareness in other countries' regulatory bodies as well, because they have to know, okay, this particular drug in India caused death cases. Now the same drug is marketing in our country also. So they will create the alert in the healthcare system, patients, healthcare system, physicians, HCP, everyone. They will make alert this particular drug is caused death cases in the Indian population. So be careful on using this medicine. Now immediately WHO will alert these cases. This program is called as WHO drug monitoring. We'll come to know again, we have separate class on this. This particular procedure, whatever I told, taken the case by MAHO, reported to CDSCO, CDSCO is reported to WHO, and WHO is informing to other countries' regulatory bodies. This complete process is called as WHO drug monitoring program. With the help of Uppsala Monitoring Center, this procedure should be done. Because we need to create the awareness in the public. Okay, this medicine is causing the death. Be careful on that. It means if you make it late, there is a chance these countries also will be affected. Not only these countries, within India also WHO need to make the alert. Officially, CDSCO and WHO both. CDSCO and WHO both need to make the alert in Indian population also, because it's still under the manufacturing of in the Indian population. Once it is proven the death cases, it is informing to every physician, every healthcare system by using the magazines, health magazines. I think you have seen immediately it was reported on the health magazine newspapers right now. Immediately this case was in the newspapers. Did you see that? It was reported in every site of healthcare system. So this procedure is very important in terms of serious adverse event cases, because it created so much of impact on the society about the safety. Then everybody will come to know, okay, this particular drug is causing adverse event, so don't take this medicine. So that is what is very important, to create awareness among the public. The serious adverse event should be processed faster. Got it, everyone?
Yes, sir.
To create awareness among the public and healthcare system, to create an awareness among the public and healthcare system, the serious adverse events and SUSAR cases should be reported faster. So very, very important question. To create an awareness among the public and healthcare system, the serious adverse event cases and SUSAR cases should be reported faster. Clear? Everyone?
Yes, sir.
Yes, sir.
Shall I go next?
Yes, sir.
Can you show me the previous page, sir?
Done. See, every note you're writing in the pharmacovigilance is very, very important question in the interviews. Make sure. I am telling you PV very specifically, point to point, because these are all asked questions, regularly asking question in the interviews. Every concept, every point, each and every point you're writing in the PV is very unique. Okay. Next. Shall I go next?
Yes,
Yes,
sir.
Everyone.
Yes, sir.
Next concept, keep the heading difference among first one, drug abuse, drug misuse, drug off-label use, drug overdose, and medication error. Very, very important concept. Need some more time, so we'll discuss clearly in the tomorrow class. Drug abuse, drug misuse, off-label use, overdose, medication error. Okay. So did you attend all the HR classes? Everyone?
Yes, sir. Yes, sir.
So everyone prepared your resumes properly, and
Yes.
make sure somebody's resume shortlisting. Your resume is not shortlisting. I'm not the reason for that, because somebody resume shortlisting, your resume is not shortlisting, means maybe you did not prepare it well. Otherwise, they might be applying the filters, maybe location filter or passed out year filter or qualification filter, something like that. So make sure your resume is well fitting. So it doesn't mean that if you decline in one profile, it doesn't mean that you are getting every profile is rejecting. So definitely your resume will be also shortlisted for suitable job roles. Many of the people who are PharmD and MPharm students definitely will get the Paraxel assessment link for sure. So whoever so applied, 2025 passed outs, 24 passed outs. I am not sure about 2026 passed outs. They are going to consider or not, because it's only second month. I'm not sure about 2026 passed outs, because it's still going on. Officially, the academic year is completed in the June, or some universities are having up to October also. Like I think Bangalore University is having the academic year up to October, if I'm not wrong, October or November. Maharashtra universities will be having around June academic year closing. So companies, I'm not sure they are considering 2026 candidates as of now, but 2025 people will mostly shortlisted for this time. 2024 also, but I'm not sure. There are chances people can get from 23 also, because I saw one girl recently placed in the Paraxel. She was passed out in 2019. She got shortlisted and got placed. So I don't know what kind of filters they are using. So filter based only, there is a chance your resume might decline, but otherwise it's not fault of any of your resume format. Format doesn't matter. The content also matters. So I'm giving the best format. People resume will definitely shortlist if you play well as per my instructions. So make sure that. Okay.
Sir, please open the third slide, sir.
Third slide. This is the first slide. Second slide. This one.
Thank you, sir.
Hello, sir.
Yes.
Sir, you just send us to the one pharmacovigilance vacancy. So in that, sir, they were asking about the experience.
See, for every job application in the portal, it's a default. They will use experience section. Okay, it's a default section for every job profiles. But some profiles may be for completely experienced, some people may be for freshers. So in the Paraxel IQVIA, if it is a fresher role also, still they use the column for experience, because they use that column whether to consider that experience or not to consider that experience. If it is a fresher role also, still it is a fresher role, because some people are applying from different experience also, no? This is role for fresher, because the patient safety associate one recently, our students only got placed to freshers, 15 students recently in December month, January and December month. So it's a fresher role, but there are so many people are applying with that. Some experienced people also there in that. Then I have to make the filter now. So they may be considered experienced, they may not consider experienced. For their wish list, they use the column for experience. So you are a fresher, better use cleaning student trainee, because that is mandatory section, right? You can't skip that. So as they
Yes, sir,
mentioned, it's a mandatory
they were
section.
asking about the date, when you started the job and when you end, like that.
They will ask that. Simply mention student training or student intern. Fresher words very important. Student intern, student trainee, fresher, like that. So just to fill that section. Okay.
Okay, sir. So then can we mention the date when we started the course and when we are
Date is
ended?
date. You can take the month base. It's not like exactly date. Take month base. I think your batch 53, huh?
Yes, sir.
Which batch? 53 or 54?
53, sir.
53 means you will have month of January, right? January month starting. Sorry, December month starting.
Not, sir.
December month starting, huh?
Yes, yes, sir. Yes.
December to, you can add December to February. If you are, if you want to take the date, for 1st February last.
Okay, sir. Thank you.
Done?
Sir, and also they ask the company name, then what they have to mention, sir?
Keep that only, cleanings only. You can use cleanings only.
Okay, sir.
But the fresher word in your resume, if you are a complete fresher, use the fresher word. 2025 passed out. Year is important. 2024 passed out. Because they use filters like fresher word, passed out year. Yeah, but I think there is no location based filter, because they are shortlisting the candidates from Karnataka as well, Maharashtra. I think different places people also getting shortlisted. So I think mostly they won't keep any location for location filter, if I'm not wrong. Okay. Fine. If you people, any if you got any test mails, test links, just update me. Okay.
Okay, sir.
Excuse me, sir.
Yes.
Sir, I have completed my bachelor's in biotechnology. So can I apply for these jobs, or should I wait, sir?
See, look after the job description and all. For this particular role in the Paraxel Patient Safety Associate, they are taking only medical student, BDS, MDS, B Pharmacy, M Pharmacy only. Not even they are taking they are taking only M Pharmacy, PharmD. They are not even taking bachelor's pharmacy also. So, but some companies, they will take everyone. If you take 40, in that 40, B Pharm also accepted, M Pharm also accepted, PharmD also accepted. Okay, so just apply, but let's say, okay. But if you get rejection, don't regret about it because they might use some filter.
Okay,
Okay, sir.
Sir,
Yeah.
sir, as a family student, we have 1 year of internship experience. Sir. Should we add that or we should mention Cliniwings experience?
See, 1 year internship experience is part of your education, right?
Yes, sir.
So you can add any of these, fine. Because this course is like helping you, no? So what is the major reason I'm telling you to add Cliniwings word? So they may shortlist by using Cliniwings word also, because many of our students already working there.
Yes,
So
sir.
institution base, I have already referred few students previously, but now they are not taking direct reference. So they might use the word Cliniwings. So they, in that case, your resume will be in the line. Got it?
Yes.
So PharmD internship is anyway part of your organization, PharmD education. So use the Cliniwings keyword. So that is also they are using to track the resumes. Got it?
Yes, sir.
Done? Okay. Chalo. Bye. Take care.
Thank you, sir.
Thank you, sir.
Thank you.
Thank you, sir.